To the Northern Cape we go now, where the Portfolio Committee on Health has commenced with its second round of public hearings on the National Health Insurance Bill. The committee says the aim of the bill is to achieve universal access to quality health care services in South Africa. This in accordance with Section 27 of the Constitution. We cross now live to SABC News reporter Reginald Vedboy, who's covering the story for us. Reginald, good afternoon to you, and thank you so much for coming through. Now, what came out of the hearings today?
Good afternoon to you, Pales, and also to our viewers. Now, the public hearings on the National Health Insurance Bill is expected to start at 4:30 up until 8:30 this evening, so we haven't started as yet. Now, like you said, this bill aims to ensure that quality health care will be given or should be given to every South African citizen, irrespective whether you are rich or whether you are poor. Now we know when you have a medical aid, then a special medical service ambulance will come out to you and will request whether you have a medical fund. If you don't have, then you should wait for a public service ambulance to come and fetch you and take you to a public health care facility. Now, without any further delays, we know that this is the second round of the public hearings on this NHI bill. The Portfolio Committee visited Mpumalanga already, and this public hearings will be rolled out to all other provinces within the country. Now, I am now joined by the chairperson of the Portfolio Committee on Health, Dr. Sibongiseni Dromo, just to tell us more about what this bill aims to see. Good afternoon to you, Doctor.
Good afternoon, and thank you very much for this opportunity.
Just someone sitting at home now watching this program asking, but what is the National Health Insurance Bill? Just paint us a picture of what this bill means for every South African citizen.
In your introductory comments, you already talked to it. In other countries, we call it a universal health coverage. As we have rightly put it, that the country must create a fund where all those who do work will prepay to this fund before the health services are actually distributed to all citizens in the country. In fact, it means there's a social solidarity part in it, in that those who have resources should be ready and available to share with those who don't have. There's quite a lot of people who are poor, there's a lot of people who are sick. Sometimes, yes, we are correct, they do not access specific hospitals because they need so much. If you don't have a deep pocket and you are unable to then care, health becomes a commodity available to only those who can afford. So this is actually trying to go towards that, and many countries who are going this route, of course some of them are in the middle or on the top of this situation, are seeing progress in terms of the quality of life of their citizens.
When we look at the services that will be offered, do we know what services we can expect?
Going to be part of what the Department of Health is going to unpack, but they say there's going to be a comprehensive health services that will actually be given. It means all the needs. I always make an example that there will be very few exceptions. For instance, if you would want to go and ask the department to pay for you putting a golden tooth, we should probably decline that. The department should decline that. I was also making a joke about it, but it's true. If you think you are overweight and you need the department to support you by doing what we call liposuction, you should probably be ready to pay for that. The best and easy way to do it is to give you some shoes to run and reduce weight. But the rest of the other packages for all comprehensive needs of our some of the things that people need dearly but cannot afford. And we see now a booming cancer in our country, non-communicable disease, hypertension, diabetes. People are dying without getting access to those facilities. So this should actually be dealing with all the communicable, non-communicable, and all other needs, equipment needs, prosthetic limbs, and all those that our people might need in our country.
And then, Doctor, when we look at the economy, how will this bill feed into the economy of South Africa?
Firstly, the starting point is the critics and the people who are actually not sure whether we should go this route. They are saying the economy of our country is not at a very good state. We now learn from countries like Japan that post-World War II, they embarked on this program. Look where Japan is now. Life expectancy of the citizens of Japan, the quality of life, and the economy of that country. We also have learned from countries like Norway, Chile, Cuba, countries that have actually gone this route to say you actually advantage a country economically if you go this universal health coverage, because citizens of those countries suddenly go up, there's no absenteeism at work, people are highly productive, and therefore the economy of the country suddenly picks up. Now we learn from those countries. We think it is the right way to go because it has those actually processes that are very much important for the citizens of any country, of any people in the world.
Just lastly, Doctor, we have the public hearings now. The bill is already in Parliament. Where to from here?
We are here in Kimberley today, and tomorrow we will wake up and go to Dar. On Sunday we are doing Uppington, and then the last day in Northern Cape will be in Springbok. That will be the end of 4 public hearings in this province. We still have, this is the second province we are doing. We still have 7 other provinces that we need to do. Hopefully we should finish by the first week of February and then have discussions in Parliament regarding this bill.
Thank you very much, Doctor. Well, pleasure. That was Dr. Sibongiseni Dlomo. He's the chairperson of the Portfolio Committee on Health, speaking to us in terms of the public hearings that's taking place across the country, saying that equal health care is important and everybody should be having basic services, quality health care services. But unfortunately, you and I, the taxpayers, we will have to, or we are going to fork out for that. Now, this public hearings will be taking place from 4:30, like I've mentioned earlier on. Tomorrow there are, on Sunday, it will be in Uppington, and then on Monday in Concordia, in Mpumalanga, also in the Northern Cape, and then all the other provinces across the country will then follow.
All right, Reginald, many thanks for that update. SABC News reporter Reginald Vetboy reporting live from Kimberley, where the second round of public hearings on the National Health Insurance Bill is set to take place. In fact, it will start now at 4:30 until 8:30 later in the evening. And of course, as Reginald said, that tomorrow the hearings will move to Uppington in the province. Peter?